Hello everyone, in this video we are going to discuss about glycogen storage disorders. So before going to the glycogen storage disorder, we have to know about the glycogenesis and glycogenolysis. Glycogenesis is formation of glycogen and glycogenolysis is breakdown of glycogen into glucose. So first glucose will be converted to glucose 6-phosphate and then to glucose 1,6-phosphate and UDP glucose and glycogen is formed with the branching enzyme, then glycogen structure is formed. It will have both alpha 1,4 and alpha 1,6 linkage. Then the glycogen phosphorylase and debranching enzymes helps in glycogen breakdown. So why these process occur? So whenever there is increase in the glucose in the body, then the insulin enzyme will act and it will try to convert the excess glucose into the glycogen. So glycogenesis then occur. Glucose is converted to glucose 6-phosphate, glucose 1-phosphate, UDP glucose and into glycogen in glycogenesis. And whenever there is a need of glucose, whenever there is low glucose levels in the body, this epinephrine and glucagon hormones will act and they will try to break down the glycogen into glucose. And glycogen can also be break down with the help of lysosomes in the body. So whenever these enzymes which are present here, whenever these enzymes are deficient or not working properly, then glycogen storage disorders will occur. So there are many disorders. Important ones are shown here. Type 1 is Gierke disease. Here the enzyme deficient is glucose 6-phosphatase. Glucose 6-phosphatase helps in conversion of glucose 6-phosphate into glucose. So since there is no conversion of glucose 6-phosphate into glucose 6-phosphate into glucose, the glucose will be less in the body. So there will be severe fasting hypoglycemia, lactic acidosis and hepatomegaly. The organs affected are liver and kidney. Second storage disorder is Pompe disease. Here the lysosomes which are actually helping in the breakdown of glycogen, these are affected. Lysosomal acid 1,4-glucosidase is the enzyme deficient. All the tissues will be affected, especially the heart is the main organ affected. The patient will have cardiomegaly, hypotonia and early death in the infantile form of Pompe disease. Third is Cori of Forbes disease. Here the debranching enzyme, that is glycogenolysis, which is helpful in glycogenolysis, that is hampered. Then the patient will have hypoglycemia, that is milder version, hepatomegaly and muscle weakness. It occurs, the organs affected are liver and muscle. The fourth one is Anderson disease. Here the branching enzyme is affected. It causes cirrhosis, liver failure and early death. The fifth is McArdle's disease. Here muscle glycogen phosphorylase is affected. The patient will have exercise intolerance, muscle cramps and myoglobinuria. We have to know one thing, that the glycogenesis and glycogenolysis occurs in both liver and skeletal muscle. In glycogenolysis, the glycogen is converted into glucose and it will help in increasing the glucose levels in the body. But the skeletal muscle will lack this enzyme, so that the glucose, this enzyme, muscle phosphorylase enzyme, is deficient in the skeletal muscle. So it doesn't help in increasing the circulating glucose levels. So it utilizes only for itself. The sixth disease is Her's disease. It is liver glycogen phosphorylase. Here there will be mild fasting hypoglycemia and hepatomegaly. Sixth is Tarui disease. Here muscle phosphofructokinase 1 is deficient. The symptoms will be like McArdle's disease, like exercise intolerance and muscle cramps, myoglobinuria, along with hemolysis. Zero is GSD type 0 is glycogen synthase deficiency. Here the affected ones are liver and muscle. There will be fasting hypoglycemia, no hepatomegaly and low glycogen. So we can see fasting hypoglycemia, severe fasting hypoglycemia is seen in Gierke disease and GSD type 0.